Started. Okay, good morning, everybody. Welcome to our side event. Welcome to the start of the second week of the subsidiary bodies. I hope you're having a productive and interesting time while you're here, and very happy to be kicking off the second week with our side event. As you're aware, this is it's a hybrid event between, we have a few people joined online. Also, our own speakers will be jumping a little bit between those who are participating remotely, as well as our panel that we have sat up here with me. And I'll introduce them as we get to those speakers. First of all, just a very warm welcome, and I'm glad to see that there's enough people here interested. I hope everybody can hear me well and hear me clearly. I think what we will do is, while speaking, I'll take the mask off, and the same for my speakers. While actually giving your presentation, you may take your mask off. As you're probably aware, we are here to talk a little bit about the COP26 Health program. We are at the point now that almost 60 countries have signed up and committed to the COP26 Health program. But this is an opportunity here to be able to give you, for some of you who may not know about it, this is a fantastic opportunity for you to learn a little bit more and get engaged, but also for those of you who have heard about it and know a bit about it to sort of see where we're going and how that work is progressing. We have a good lineup, though we will just have to admit that there's been some very small changes, and there's one or two people, as you can imagine, as negotiations go on. Some speakers may or may not be able to make it, and we will just have to play it by ear as we go on. So I apologize if there may be some slight differences to what's on the original program. Okay, I would like to kick off. I'm very happy to introduce Chris Carter. He's the Deputy Director and Head of Human Development Department at the Foreign, Commonwealth and Development Office of the United Kingdom. Very happy that you are able to make it and join us here today in person. And Chris, I think you're going to kick off and give us a little bit of an overview on the COP26 Health Programme.
I am. Thank you very much, and I'm very happy to be here. So firstly, thanks to the WHO team for arranging the session. Today I want to cover why investment in climate change matters for health, how health systems are part of the solution for net zero and climate resilience, and more about the COP26 Health Programme that we've just been hearing about, but specifically what we need to do now. So WHO have declared climate change the greatest threat to human health and well-being. That means the climate crisis is also a health crisis. Climate change is already causing increased illness and death, affecting the social and environmental determinants of health, such as clean air, safe drinking water, sufficient food, and secure shelter. And through frequent weather events, such as heat waves, storms, and floods, increases in zoonosis and food, water, and vector-borne diseases. And it also impacts mental health. That means that almost every climate story is also a health story. So, for example, spikes in waterborne diseases during the floods in South Sudan, higher temperatures causing premature deaths in Australia, malnutrition in Syria, where families face the bread crisis after another year of conflict and failing crops. So we know that estimates suggest that climate change will push 100 million people into poverty by 2030. But do we know that it will likely cause 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress between 2030 and 2050. And there is a risk of a 20% rise in hunger and malnutrition by 2050. And we simply haven't been paying enough attention to the impact of climate change on health. We know that reducing emissions of greenhouse gases through better transport, food and energy choices improves health. And the IPCC Working Group 3 co-chair, Piradasi Shukra, is clear that the right policies infrastructure and technology can change our lifestyles and behaviour and result in a 50 to 70% reduction in greenhouse gas emissions by 2050. And what the evidence is telling us is that these lifestyle changes can improve our health and well-being as well. Health systems must be part of the solution. They have to be strengthened to become resilient and sustainable to withstand and respond to the coming impacts of climate change. And it also makes financial sense. Given estimates predict the direct damage cost to health of climate change will be between $2 to $4 billion a year by 2030. So $2 to $4 billion per year by 2030. Means we have to act now. And this is why the UK co-led a successful COP26 Health programme in partnership with the WHO, the wonderful Health Care Without Harm, and others here today. What we wanted to do was bring a strong focus on health at COP, make powerful health arguments for climate action, and promote transformational change. Most importantly, promote transformational change in health systems globally. So what was the COP26 Health Programme? Well, we urge countries to make two commitments in particular. One, to climate resilient health systems, and the second, to low carbon sustainable health systems. So the first to climate resilient health systems, the second to low carbon sustainable health systems. And then there was another part which is around advocacy of health workers on climate change. As we've heard, 59 countries now have made public commitments to either or both of these. So that includes 19 countries setting target dates for net zero before 2050. And that represents a third of global health care emissions. So that was a big success. The commitment on climate resilient health systems is about designing health systems that are better able to cope with increased strains and demands climate change will place on them. So to do that, a country must first conduct a climate change and health vulnerability and adaptation assessment, and using this to develop a health national adaptation plan as part of their national adaptation plan. The second commitment on sustainable low-carbon health systems is recognising that health systems contribute 5% of global greenhouse emissions. So they themselves contribute to the problem. We're asking countries to undertake a baseline assessment of greenhouse gas emissions from their health systems and then create action plans to develop sustainable low-carbon systems, including in supply chains. So as I said, that was a big success, 59 countries. But we know that these commitments will be meaningless if there's no action. In fact, all of this will be meaningless. So to build on the COP26 Health Programme and these political commitments, we have established an alliance for transformative action on climate and health. That's ATTACH, the Alliance for Transformative Action on Climate and Health. And that's in partnership with WHO in Egypt. And it will be inaugurated on the 27th of June. We've invited ministers of health from committing countries, partner agencies operating in both health and climate sectors to participate along with multilateral organisations, civil society, bilateral donors, implementing agencies and private sector alliances. So we hope they will all be there, and hopefully many of you. What exactly is ATTACH, and why do we need another partnership? So ATTACH offers a platform for knowledge and experience sharing, support in accessing technical assistance, and collective efforts to mobilise resources. It will monitor the delivery of these commitments through country-level and global data collection, helping track where support is required, and also identifying where there's best practice, who's making most progress. We want the Alliance to find bold and innovative solutions to the global constraints to decarbonize global health sector supply chains, and also to access finance for developing countries to build their resilient climate resilient health systems. So to truly drive this agenda forward at pace and at scale, it needs cross-sector partnerships. That's why we needed to form ATACH. It is the only way to build on the rapidly growing body of international work in the climate and health nexus. We're going to use it to understand the threats, develop policies and plans. And that will lead to action. And actions such as capacity building for healthcare workers, provision of renewable energy and clean water to health facilities, and sustainability in healthcare supply chains, which is a big part of the problem. We want to build better collaboration between a range of ministries, private sector, civil society, and the international community, which is essential if we're going to make progress. And we want to build a proactive community that recognizes the inextricably linked benefits of action on a variety of health, climate, and environmental outcomes, instead of working in silos. So we hope ATACH will do all of this. It's so important that health remains high up on the COP agenda and other climate action fora. I'm sure many of you believe that, and we're going to hear more about this through the rest of this morning's session. So that's enough from me. Thank you very much for your time. I will now hand over to Dr. Dermot Campbell-Landrum of the WHO. He's going to provide more technical detail. Back to you.
Thank you very much. I'm just going to cross over. Thank you very much, Chris. It's the UK has been a very strong partner on this, and it's as you've shown, it's not just about the launching of the program, but it's also driving forward work on this to maintain that momentum and that continuity. But to now look in a little bit more detail on what we're doing and where we stand right now. Dermot, we've shared your screen and we can see your slides. So Dermot Campbell-Landrum is joining us remotely, and he is the head of the Climate Change and Health team at WHO. And over to you, Dermot.
Wonderful. Thanks a lot, James. First, can I just do the now traditional check that you can hear me and see my slide and so on?
We can indeed. We can hear you clearly and we can see your slides.
Wonderful. Well, thanks very much, James. And so thanks for the organization of this event, and particularly thanks to our colleagues in Bonn in our European regional office, so James and Vladimir and colleagues. So I am speaking to you from Geneva. This is part of our our efforts to work across WHO and also to save carbon emissions and rely on our colleagues on the ground wherever we can. And I'd just like to, in just 10 minutes or so, just to follow on from the excellent introduction that Chris has just given as to why we think this area of action is so important, how it really builds coherence between action on climate change and action on health, and a little bit more detail on the next steps that we need to take. So basically, at WHO, we have been working on climate change and health in one form or another for about 30 years now, and scaling up action over that time. And it's a broad ranging, it's a complex area, but we think we can basically summarize the task for public health into three main tasks. One is in addressing the wide range of health impacts of climate change, and Chris has just described a few of those. The second is in strengthening the climate resilience and environmental sustainability of health systems and facilities. And the third is in promoting the health co-benefits of climate change mitigation in other sectors. So the many things we need to do to cut carbon emissions will actually bring huge gains for health. To such an extent, they will actually cover the cost of cutting the carbon emissions. And so this new initiative and the commitments that we've asked countries to sign up to are completely in line with what we think are the headlines from the health side in what we need to do to respond to the threat of climate change and to get the health gains from the response to climate change. So it's all part of that same coherent silo busting agenda, if you like, that Chris has just outlined. And the reason we think this is so critically important to do, we've been summarizing the evidence for a long period of time. The IPCC has also been summarizing the evidence for a long period of time. And the evidence doesn't get any better. No more good news is coming about the threats and the impacts of climate change on health. And so the last IPCC report released just a few months ago for Working Group 2 on impacts and adaptation. The summary of the observed impacts of climate change on health are summarized in this slide for different impacts, different parts of the world and globally. And as I say, there's almost nothing positive to say about this. And that's just what we've been experiencing up until now with the relatively modest amounts of climate change that we've seen so far. And we're also seeing that reported directly back to us from countries. So we support countries around the world to carry out those vulnerability and adaptation assessments that Chris has just described as one of the things that we're encouraging other countries to do. And across the board, we're hearing countries come back to us reporting the threats or the observed impacts across those range of health impacts, from infectious disease to extreme weather events and emerging impacts such as impacts on mental health and impacts on healthcare facilities and systems. So the threat is a systemic one. It's not something we can solve with a single vaccine or a single intervention. We also see that the projections for the future are not good news either for health. So again, as we look across these range of health impacts, we do see that we expect these impacts to increase and to scale with temperature change. So the more temperature change we get, the bigger the impacts that we see. But another important part of this message is that we as the health community and the IPCC also agrees, consider that if we have proactive adaptation within health systems and the systems which support health, we can actually we can avoid a large part of those health impacts. So we can offer a great deal of protection. And this is the part of the COP26 initiative that deals with building resilience in health systems and the systems that support health, such as water and sanitation, food, and so on. So there's a great deal that we can do to take the edge off the health impacts of climate change. I'll just very quickly refer to those health co-benefits that I mentioned, and I think Chris has also alluded to. At the moment, we lose about 7 million lives a year due to air pollution. About half of that indoor air pollution, about half of that outdoor air pollution. About 2/3 of the outdoor air pollution comes from the burning of fossil fuels. And so the drivers of the climate crisis are also taking many, many lives at the moment. These are avoidable deaths. So we also think that it's critically important that as we work towards decarbonization of health systems, we also do that in a way that also brings the health gains that we know are out there. This slide has a little bit of detail. It's what I consider to be the most important summary slide of the third working group of the IPCC, which reported just a couple of months ago. The bottom line here is that there are opportunities, there are solutions to cut carbon emissions across all sectors, all of the emitting sectors, energy, land use, buildings, and so on. And a large part of these are actually cost saving already. So anything in blue on this slide means that we would save money by doing this. We should just go ahead and do this. And we see the biggest opportunities in energy. We also see big opportunities in food systems and agriculture. We see big opportunities in transport. And the other part of the good news here is that this is even without taking into account the health gains. And those health gains are really large. So one of the other things that the IPCC Working Group 3 concludes is that the economic benefits of those health gains are actually bigger than the cost of mitigation. So health is a really strong argument for why we should cut carbon emissions. We want to align those. So that's part of the thinking which has also gone into the COP26 health commitments. sorry, the health program. And Chris has already alluded to this. The top two items here are the ones where we've already asked countries to sign up. So the 59 countries that you've heard referred to around climate resilient health systems, around cutting carbon emissions from the health sector. But there are also other important areas of work which are within that overall program on promoting healthy nationally determined contributions, so showing how we can cut carbon emissions and get health gains, and also mobilizing health voices for climate action. And I'd just like to underline the point that health is one of the biggest employers in the world. It also has the most trusted employees in the world as well. So it really matters that health organizations from around the world, particularly in the last couple of years, are really stepping forward on this. So very briefly, just a little bit more detail on those health commitments. You've heard the number several times already. We already have 59 countries signed up. We do have more countries joining all of the time, so want to increase that number. We have countries from around the world, from some of the richest countries in the world to some of the least developed countries in the world. So we want to carry on building up that number of countries. But as Chris has said, it's even more important that those countries are serious about their commitments and they're supported to deliver on those commitments. So again, you've heard the headlines of these. So we're asking countries to commit to carry out assessments, to develop the health components of national adaptation plans, and to set targets or at least set a route of travel for cutting carbon emissions from their health sector. Now, we think these are reasonably easy things to sign up to. We're encouraging countries to go as fast and as deep as possible, but we see no reason why any country shouldn't sign up to these. It's at least to the level of making an assessment and a plan to adapt and to cut carbon emissions. And we also offer support. So at WHO, over several years, we've been working on supporting building climate resilience into health systems. And critically, we're not asking countries to reinvent the wheel. We're asking them to take the core functions of their health systems and to basically build climate resilience into the outer ring in this diagram, onto the core building blocks. And we also want to support them to have access to finance. We can support them to train their healthcare workers. We can offer technical support on climate-informed surveillance systems and on healthcare facilities, for example. So that the support is out there. And at WHO, we're entirely committed to back that up. Just a couple of words on that commitment. Our Director General, Dr. Tedros, has just started his second 5-year term as head of WHO, and he has pushed health promotion and disease prevention to the top of the agenda and highlighted climate change as the single most important issue within that. He has also committed on World Health Day this year that WHO will itself be carbon neutral by 2030. So we consider that we're walking the talk, both in what we do and how we back up countries. Just a final couple of words on the commitment around decarbonisation of the health sector. We're very much aware at WHO that countries are in very different positions along the spectrum. Some of them have health sectors which already emit a large amount of carbon. We have some health sectors which actually need more energy, so they need to have energy supplied to them. So we need to have something which takes into account that difference, but also lowers carbon emission in the high emitting ones and helps the poorer countries to be on a trajectory towards providing their energy needs, ideally by renewable energy, clean energy, because in many cases, this is already the cheaper form of energy in the first place. And again, we can provide technical support here. And one of the first things we're doing is to support countries to carry out an assessment of the carbon emissions from their health sector and to look at ways in which they can cut their emissions. So the final slide that I have is basically just a summary, as Chris has just alluded, on the ATTACH, the Alliance for Transformative Action on Climate Change and Health. You've heard the headlines already. You've heard the objectives of this. And just to summarize again, the operating mechanism. This is something that we're convening as WHO with the UK, and we've also invited Egypt to co-lead this as the current and next presidents of the COPs. But this is open. It aims to support mainly the countries, but we also want this to be a broader partnership with all of the partners that Chris has just alluded to. And we think that this should support action across mobilizing financial resources supporting climate resilience, decarbonisation, and decarbonising the global supply chain, because that's actually where most of the carbon emissions come from. It's the healthcare supply chain, not just what goes on in facilities. As Chris has already said, the inaugural meeting is 27th of June, and we'd very much like you to participate and to contact us to join this initiative. So thanks very much, and I'll hand back to James in Bonn.
Thank you very much, Dermot. I hope everyone managed to see those slides quite well. There was a bit of a craning of the neck needing to take place here at the table for us to be able to see that. But really putting some data behind there as well. For everybody in the room, if you have questions, we've had two excellent keynote speakers there. Please just hold on to your questions. There will be an opportunity towards the end where we will be able to turn to you and our panelists, but as well as the two keynote speakers will be here, and we'll be able to take some of those. Also, there'll be an opportunity for you to jump in, and if you would like to contribute. Moving on, obviously progress needs partnership and cooperation, and to sort of show that and show the ongoing work with our partners, we have a panel discussion now. Unfortunately, due to the ongoing negotiations, and as we did originally reached out to our counterparts from the Egyptian presidency team, and unfortunately they have been unable to make it, but I'm sure we can all forgive them because we can understand the pressure that they're under. But I also just want to quickly ask, is Mr. Ampaivan from the Lao People's Democratic Republic in the room by any chance? Okay. So I have two colleagues sat with me on the table here. I've got Alison and Anna. I will introduce you when we get to you. But first of all, Alison, I would like to turn to you. Alison, you're representing the Global Climate and Health Alliance today. And to kick off the panel discussion amongst our partners driving forward progress on this initiative, I would like to hand over to you. And I understand you have some slides. So, yeah, we'll just quickly share these. Dermot, can I just ask you to confirm whether or not you're able to see the slides?
I can perfectly, thank you.
That's great. Anna, Alison, over to you.
Yeah, hello. I'll take this off. Thanks for asking us to present here, and I think what you hear from the civil society side aligns really well with the first two speakers. It's almost as if we coordinate occasionally, so that's great to see. So I'm talking mostly about the Global Climate and Health Alliance and the actions they are doing really to support the WHO and the Glasgow initiatives. And also about how the work of GCHA feeds into the negotiations themselves, and then just touch on the Health and Climate Network that I also run, which I'll explain the difference as we go along. And I think what you'll find is in this negotiating space, you'll find civil society actors and health professionals increasingly in these halls and increasingly engaging directly in the negotiations themselves, and really bringing a strong, vibrant health sector voice, a trusted health sector voice, really putting health as a central issue for climate change, but also calling for action from climate actors and energy actors and food actors and all those different sectors to really make sure that health is an outcome from the negotiations. So just to start, background to Global Climate and Health Alliance started in 2011. An alliance of health organisations working together to address climate change. And as I said, to elevate that voice of those health actors from across the world. GCHA is a co-chair with WHO of the WHO Civil Society Working Group to advance action on climate and health. So really pulling together that health civil society voice, those health actor voices from around the world to be in the spaces and be a voice on climate and health globally. Really directly in support of the initiatives you just heard about, we've just launched, and please, if you're working with any training or organisations, universities, please tell them about this letter, get them to act on this letter. We've just launched a letter, an open letter to universities and all educational stakeholders calling for strengthening of climate change education for all health professionals, not just medics and doctors, but nurses, physios, all of those across the health sector provision, and not just new students, definitely new students, as we'll hear from Mohammed, but also continuing education. And that this is recognising climate change, the direct impacts, the heat stress, the migration of diseases, but also looking at how climate actions, if done well, can be health actions from clean air, healthy diets, and so on. So what's the letter? And I think the other thing to recognise is that, and I think it's been identified across the other speeches, is those most impacted, as ever, are most vulnerable, often lower income, those with least access to healthcare provision. So I think, and adapting those out, the education we're presenting here to your national context, to your local context, so it's training the medics and the health professionals needed for your local needs on climate change. Calling specifically for integrating climate and health competencies into the health professional curricula, but also getting that health lens to support the development of educational programmes on climate change and health, on climate change and health in other sectors, in all those other sectors. So getting the health bit right, if they're going to teach it right, teach it correctly. Also, obviously, to get more resourcing into this climate and health education. And I think, importantly, getting those agencies, these universities and other training organisations sharing that. So there's a call in the letter for educational establishments to sign up, but really to do more than that, to make a commitment. What are they going to do? What are they doing, or what are they going to do in the coming years to make sure that their students are and professionals are educated in the impacts and responses to climate change? I mentioned also that, so that's really a direct response to this initiative, but there's increasingly health voices coming into the negotiations. Last year, ahead of the COP26 in Glasgow, GCHA launched this Healthy Climate Prescription Letter, and they got over 600 health professional organisations from across the world, representing 46 million health professionals in 100 countries signing on to this letter. And what was it asking? It was asking for NDCs to be ambitious, because you need to stop climate change to help health, but also to have health benefits directly in those NDCs, really demonstrate the national, very immediate impacts that you can have on climate action on health. It asked for, and I'm sort of zoning in there. Yeah, I mean, the other one is a really rapid fossil fuel phase out. Cutting fossil fuels will help help achieve 1.5 degrees, but it will also take away the air pollution that we saw in some of the slides that Dermot showed. We're looking for. I knew I should have worn my other glasses. Yeah, so actually, as we've heard, building climate resilience, climate action into the health sector, and then looking for investments. As we come out of COVID, we're investing in recovery, making sure that is healthy and green. So this letter is still active and will go on till Sharm el-Sheikh this year. Now, one of those asks was around the NDCs. How do we account for health in the NDCs? And very helpfully, for all the countries that are represented here, GCHA with others have a scorecard. How well is your country doing on health and climate? And all on direct impacts, on adaptation measures, on the co-benefits, and on looking at there's actually the economic co-benefits of health action within the climate sector. And we've been ranking, you can see from red, the ones who are not representing health in their NDCs. These are only showing the countries we surveyed, to green and deep green for those who are doing quite well and actually showing those health benefits. So that's really partly to push countries to move up that ranking, but it's really just helping countries to elaborate their own health implications within their NDCs, and as they renew and update their NDCs. Yes, and I just wanted to then come on to the network that I particularly run, which is the Health and Climate Network, which is slightly different. What it's trying to do is get those health professionals talking to people in the energy sector, in the city sector, those working on food systems, those working on transport, so that we're co-creating policies So we're co-creating a transport policy that has a health outcome, and we're getting health messages to make that message and that action accurate. So we're co-developing policies. These are the briefings we developed in these sectors last year. And then we're taking those briefings into the public space through social media, going to transport and food summits and calling out the health benefits, having events at COP26 last year, having an exhibition stand, and then working locally with some of our national and sectoral partners to get that message out there. So again, spanning all those things that we heard in our previous and getting civil society and health professional voices in there. Thank you.
Thanks a lot, Alison. That looks fascinating. Those scorecards are a very, very easy way to very quickly be able to see who we should be talking to at events like this. So thank you for sharing that. I also want to apologize. We also have a remote participant on the panel today, and that is Mohammed Isa. He is the Liaison Officer for Public Health Issues at the International Federation of Medical Student Associations. And he is actually joining the panel discussion online. And Mohammed, are you there?
Yes, I am.
Hold on 1 second. I'm just going to find you here. There we go. You're on the screen, and we can hear you clearly. So, Mohammed, just as people probably know, the International Federation of Medical Student Associations is a very strong youth partner, working closely with the WHO and also working as an advocate for climate change and health, and particularly getting health on the agenda. And Mohammed, would you like to jump in there?
Yes, of course. Thank you so much. Can you confirm you can hear me well?
We can hear you.
Perfect. Thank you so much. So I'm very happy to be here in the panel today, although remotely, but still it's very interesting to contribute and to raise the voice of the youth and the medical students when it comes to climate change and health. IFMSA has been working in this field for so long. I can't even remember when did we start working on climate change, but we have been working on this for so long, contributing through COPs, trying to include health on the agenda, and not just this, but also empowerment and the capacity development of the youth. We believe it's very important that when we get to work on such a critical crisis that we're facing in terms of the climate change, it's very much important not just to focus on the present, but understand the root causes of how we reach this point and also contributing to a more sustainable future. And by sustainable here, I don't just mean in terms of climate change, but also in terms of sustainability of our actions and our contributions to the climate action. So in terms of the youth and in terms of the medical students, we have been working on, as I mentioned, capacity building on the individual level through different workshops, different webinars, and different assemblies and regional meetings. This has also been coupled with capacity building on the institutional level and creating the enabling environment in order to ensure that our work is impactful enough. And by this, we have worked on different policy documents when it comes to climate change, when it comes to air pollution, when it comes to food systems and nutrition. So we have worked on policy documents on these topics in order to represent our stances in an evidence-based manner when we are present in speaking opportunities like these, or even in COPs and other meetings. In addition, we have also worked on changing the mindset, because it's not just about what you say or what you do, but as I mentioned, changing how the organization works, how the environment around you is working, in order to make sure that when we speak about climate change, it's not just that, okay, you need to do this and this and that, but it's also important that this becomes the norm in the community that you're part of. So we have been working, for example, on having environmentally sustainable meetings in the IFMC by creating specific guidelines for these, ensuring that our default options when it comes to general assemblies, regional meetings, and team of officials meetings to be planned. So we're trying to change how we do things as well. So all of these are examples of what we do on the international level, in addition to having a specific program on environment, climate change, and health, to which all our national member organizations who work on climate change issues can enroll their activities and showcase what they have been doing on the national level and the local level as well. when we speak about this, it's very much important. For example, I'm from Egypt and COP27 is happening in Egypt. So it's very much important that it's not just based on where you come from or whether you are in the country that hosts COP or in the region that hosts COP, but everyone must be involved. And this is also a mindset that we need to incorporate when we get to work on the climate change. Yes, this COP is happening, the next COP is happening in Africa, but all youth must be equally engaged and equally involved in order to ensure that further COPs or like further decisions or further actions taken on the climate crisis are beneficial to everyone. And from here, it's very much also important to focus on the determinants and focusing on the empowerment of youth at all levels. Yes, for example, in the IFMSA, we get to empower and we get to build the capacity of the youth. However, the youth themselves need to create their own platforms, whether during the decision-making processes or even outside it, in order to learn, in order to contribute, in order to meaningfully engage. So it's not just about engaging, but it's also about meaningfully engaging in order to understand, for example, when we get to speak about mitigation, when we get to speak about adaptation, when we get to speak about climate financing, all these things, when we get to ask our decision makers to do 1, 2, 3, we need to be able to understand what we're speaking about in order to make sure that we are providing concrete, realistic actions that will take us forward in order to tackle the climate crisis. So I believe the youth has so much potential. The youth need to empower each other more. They need to do things and be given the platforms in order to contribute more to decision-making processes, whether during COP or even outside COP. I personally believe that, for example, during external meetings, yes, it is the platform for all of us to engage, all of us to speak, but the real work happens outside these external meetings. When we get to be part of the preparation process, when we get to be part of every single detail in order to ensure that we are contributing to the climate action. So from here, according to also what the other panelists mentioned, I'm very happy that we are focusing now on the inclusion of the climate change in the education, in the curricula. This is very much important for us to understand, as I mentioned, the roots, how the climate change is affecting us, what we need to do more. So as long as this gets to be part of the formal education, then I believe this can be a way forward for everyone, for all the youth to be well engaged from the very beginning in the climate change crisis, to be able to contribute more meaningfully into the issue and into the climate action. Thank you.
Yeah, we have, as you said, you've been there from the beginning, and we're always ever so grateful for the enthusiasm that you have been able to, and your colleagues at IMFSA have been able to contribute. I would now like to turn to another very long-standing cooperation partner with us, Healthcare Without Harm. And I'm delighted to welcome Anna Furman. She's Climate Officer. And Anna, if you could just, would you be able to give us a little bit of an overview on decarbonization in the health sector, which is what we're going to need?
Absolutely. Well, first of all, good afternoon, everybody. It's an honor for me to be here representing Healthcare Without Harm for an NGO that has been working for health sector sustainability for the past 25 years. This convening today is nothing less than a dream come true. The COP26 Health program is in itself an unprecedented achievement. Not only does it put health at the center of the international climate process, but it recognizes the dual nature of climate and health nexus. The health sector is both highly vulnerable to the impacts of climate change, and it's also a significant contributor to the emissions that drive it. As the COVID-19 crisis has painfully shown us, fighting global health risks and diseases, including outbreaks with pandemic potential, it's increasingly about fighting climate change and environmental degradation. At the same time, the health sector cannot continue to betray its own principal mandate to do no harm by generating almost 5% of global greenhouse gas emissions, contributing to what we all here recognize as the greatest threat to global public health of the 21st century. So our mission is twofold. We must build health systems to withstand the impacts of climate change and simultaneously deploy climate-smart and environmentally sustainable healthcare as an anchor strategy to achieve more equitable access to care and build healthier, more resilient communities. I'd like to focus on the latter, which is where Healthcare Without Harm has mostly focused its efforts during the past years, while recognizing that those two are essentially interdependent goals. There are 3 specific commitments under the Decarbonization initiative of the COP26 Health Programme. The first one is to deliver a baseline assessment of greenhouse gas emissions of the health system, including the supply chains. The second one is to develop an action plan or a roadmap by a set date to develop a sustainable low-carbon health system that also includes the supply chains and also considers human exposure to air pollution. And third, for high emitters and any other country with a high ambition, to set a target date by which the committing country's health system should reach the net zero emissions, ideally by 2050. Now, before I go into what has been happening on these fronts, I'd like to take a moment and just to recognize that out of the 59 countries that have so far joined the program, 54 have joined the Decarbonization initiative. And we originally expected only a handful of countries to join. And what's more, we thought they would be mostly developed countries, but it turns out that out of the 19 countries that also presented a target date to reach net zero, 15 are developing countries. That speaks to the growing global demand for a greener, more responsible way of delivering healthcare that responds to the sector's larger healing mission in the age of climate change. Now, with regards to baseline setting, global discussions on the methodology continue to evolve. And at Healthcare Without Harm, we have addressed this challenge from 2 institutional perspectives, one's top-down and one's bottom-up. The top-down approach is thoroughly presented in our global roadmap for healthcare decarbonization that we published last year. It looks to estimate national health sector emissions using national data, particularly expenditure data derived from global input-output databases. And to support the countries that have committed to decarbonization of their health system under the COP26 Health Programme, our Europe office is now leading a project called Operation Zero, with the aim of translating the global roadmap approach into an actually actionable methodology for national and subnational governments to estimate the health system baseline emissions and develop a decarbonization plan or roadmap. The soon-to-be-published methodology helps policymakers create the right conditions and also guides technical staff to actually create a robust baseline and a decarbonization roadmap for their country's health system. It was built collaboratively with 3 pilot health authorities in Europe, and this year and the next we're going to test it out, and we work with more governments both in Europe and the Global South to test it in a more diverse context. Now for the institutional bottom-up approach for the level of healthcare facilities. Since 2016, we developed an emissions calculator specifically for the healthcare sector, which we call the Climate Impact Checkup tool. It was originally developed for the Latin American and Caribbean region, but is now available worldwide for the members of our Global Green and Healthy Hospitals network. And more recently, it's also available through an agreement with the World Health Organization to all national governments who wish to use it. Our very first attempt to estimate a national health system carbon footprint using our Checkup tool on a representative sample of healthcare facilities is currently ongoing in Colombia. Our Latin America team is working closely together with the Colombian Ministry of Health and Social Protection on this project. And we hope this will produce relevant learnings and increase our understanding of the bottom-up data collection process so we can eventually replicate this approach in other countries and other regions. Now, while the COP26 Health Programme is what brings us together today, I want to finish by acknowledging that non-state actors within the health community have been equally important to the country governments in building the movement for healthcare climate action, if not more. And it has been super rewarding to see, for example, that more than 60 healthcare institutions representing over 14,000 hospitals and health centers in 22 countries have so far joined the United Nations Race to Zero campaign. With this, they're committing to halving their emissions by 2030 and reaching net zero emissions by 2050. Once again, we have been happily surprised by the level of engagement of institutions from the Global South as well. Regardless of where they're located, we must celebrate those healthcare leaders that in the midst of a health crisis brought by COVID-19 have stepped up to respond to the even greater crisis that climate change represents. Now, to support these committed hospitals and healthcare providers, we have also created a decarbonization toolkit for healthcare facilities. This one was piloted in a recent project by hospitals in the Mediterranean region here in Europe. And the toolkit helps the healthcare providers to establish internal carbon management teams and plans to transition to zero emissions healthcare by 2050. By taking a health provider level approach during this project, we provided hands-on support to the participants, and we piloted this bottom-up methodology to carbon management. And finally, this intervention would not be complete without recognizing the crucial role of healthcare professionals in driving transformation within and beyond the health sector. Thanks to the trusted voice of nurses, doctors, and all the other allied healthcare professionals, we're starting to see a broader societal shift now towards an understanding that we need to take care of our planet to be able to live in a healthy and just world. Thank you very much.
Thank you, Anna. Oh, there's definitely a lot of shared sentiment there. And indeed, we are seeing a lot of societal shift and understanding of these issues, and we really do need to keep that momentum and drive that forward. We now have an opportunity to, it's your turn. And first of all, just before we go for like general questions and answers, I just want to ask if there are any party negotiators in the room, anybody who would like to give specifically a national perspective, just in case there's anybody there who would like to sort of say something on how the situation is in your country, whether or not you have signed up to the COP26 Health program, whether or not that's the first time you've heard about it and would like to follow up and know more. But just before we go to everybody, I just wanted to just give an opportunity in case there were any countries. Okay, then we will just open that for a free-for-all. So we have the panelists, we have keynote speakers, we also have the colleagues who are still online. So please, please feel free. Do we have a microphone for the audience, just in case? Please put your hand up if you've got any questions. When you do, please introduce yourself, particularly for everybody who's online. And if you know who you'd like to direct your question to, let us know.
Thank you so much, and thank you all panelists. My name is...
I think it should be working.
Is it working? Yes, thank you. My name is Jutta Litvinovic, and I'm working for the German Ministry of Environment. And I'm also co-chair of the WHO Health in Climate Change working group in Europe. And I'm very happy that climate change and health get such attention, and that we finally have the success that we were trying for so many years to come to the awareness how things are correlated to each other, because we finally speak about planetary health. We need the environmental media in a healthy state, then we have a good basis for the plants, for the animals, and for the humans. And of course, also socioeconomic factors have to be taken into consideration. And human health is depending on the whole surrounding. And for this, we have the UN Sustainability Agenda 2030. And perhaps we could also speed up a little bit and also push this agenda to become more vivid, because we have all the other aspects in health systems like waste management, like water, like saving resources. And on the other hand, of course, the nutrition and the decision of every being with a decision on what I eat. I also influence the surrounding. I influence the the environmental media. And for this health in all policies, it's really what we have to come up with, that whatever we state and whatever we do, it will have an impact on ourselves. And perhaps we can stress a bit more the carbon age tool, which was elaborated by WHO, also to see what does it mean on the energy sector when we have savings? What does it mean to humans? What can we save there? And of course, we have to stress in the environmental sector the precautionary principle and the prevention in the health sector, which for my feelings, they are coming a bit too short, and we can develop a bit more and stress a bit more and speed up a bit more. So thank you.
Thank you very much. Yes, Planetary Health, as you many people here will have also been aware, this year we've really got a jumping on the bandwagon here. And World Health Day this year also focused on our planet, our health, and indeed it's more than just. We're not working in silos. Another thing that Chris mentioned, we are getting out of those silos. We're having to look at everything and into how it's interconnected. Chris, absolutely, please do.
Get my mask off. No, just say I think that's a very important point. And I head up a department that also deals with malnutrition, health systems more generally, sexual reproductive health and rights, lots of others, development areas. I think you meant the sustainable, did you mean the sustainable development goals? Yeah, in 2030. Yeah, we feel very strongly about this, and we feel that some of the big development banks, like the World Bank, could be doing a lot more, the UN generally, and we need to get it out of its silos. So, yeah, we're mainstreaming. We're looking at how we can mainstream across all our development work as the UK as well. This looking at the impact on climate change, well, of climate change on those sectors and vice versa. But thanks for that.
Thank you. Also to the rest of the panelists and keynote speakers, if you do have something or you want to respond to one of those comments, also for those of you online, please just raise your hand, particularly Dermot and Mohammed there. We've got teams up, so if you have something that you would like to comment, rather than me putting someone on the spot, I would rather, if you, like Chris just did, just let me know. Dermot, I see you've just popped your hand up if you would like to make a quick intervention there.
Yeah, so first, hi to Jutta. And I think it's also a good opportunity to thank the German government, who have been very supportive on this issue, again, for a long period of time. And it does seem that this is an issue which is, as you say, Jutta, has finally sort of come to the fore at something approaching the appropriate level in a way that it wasn't before. I've just this morning been reading the G7 Climate and Environment Ministers communique, which is great. I mean, it's really comprehensive under the German leadership, and to me reads like a health document because it talks about climate action, it talks about action on chemicals, it talks about the benefits of more sustainable food systems, and the health ministers discussion under the G7, and again under the German leadership as well, is very, very strong on climate and health. So I'm mainly just intervening just to support the comments that you've made and to pay tribute to people who have been engaged in this issue for a long period of time, that finally I think it is being pushed right to the front of the agenda, but also to underline that point that you've just made, that sometimes even I think within action on environment and health, we can be too siloed. We have a climate change team, we have other teams working on air pollution and so on. We do collaborate, but I think as soon as we understand that central point that there is no human health without planetary health, that we have to maintain all of the life support systems across the board in an integrated manner, and that we should be backing each other up as each of us supports action on each, perhaps in a more specialized area, the stronger we will be. Because because we have to take that agenda forward as a whole. And I think that rather than competing, I think that action in one area actually supports and encourages people to take action in other areas, whether that's at the governmental level or even at the individual level. People who who take individual decisions to have more sustainable and healthy diets are probably also more likely to to take action, which is around sustainable transport and environmental protection and so on. So I think it feeds into each other and is synergistic. So that the more that we support each other to drive the whole agenda forward, the better. And yeah, I'm sure my colleagues in Bonn will join me in just encouraging and thanking the German government as well as the UK government and others around the table to continue the leadership work that you're showing in this area. Thank you.
Absolutely, indeed. And also, I can just jump in also from one of the initiatives that we're really driving forward in our office is also the concept of One Health. And even just earlier this month, we had a quadripartite meeting between the World Health Organization, the World Organization for Animal Health, the Food and Agricultural Organization, and the United Nations Environment Programme sitting together so that it is actually stronger coordination on those issues within the UN system, also bearing in mind that as the part of an ongoing iterative process that all the other agencies that we have working on biodiversity, climate change, etc., can come on board and that we have a little bit more coordination. So thanks a lot for bringing that up. And to the two keynotes who've just jumped in with their statements. I did see some other little hands popping up there. Perfect. We have a microphone already. Please introduce yourself and...
Can you hear me?
We can hear you.
Okay, thank you so much for this insightful side event. My name is Watan Muhammad from Sudan. I'm here presenting the youth constituency, Yango. So my question can be for any of you, which is how can youth, medical students in this case, contribute, especially those who comes from countries that are not committed to the health and climate program? Because I just saw my country in the map road and it's not committed to this program. What can we do? And I mean, if there is no commitment or governmental recognition, we cannot do anything. So if there is any advice or things we can do. Thank you.
That's a very good question. I'll put it to the panelists, and also from a youth perspective, we also have Mohammed online. He's probably also quite familiar with that situation. But would any of you like to jump in? Mohammed, would you like to respond to that? Were you able to hear that?
Yes, exactly, yes. So yeah, you can hear me now, right?
Yep.
Okay, perfect. So yeah, in terms of this, I understand the like when it happens that some of the countries do not commit, or like we want our countries to do something, but they might not be doing enough. I have seen these examples from many countries. However, the thing is, we need to use like the basic resources that we have. So, for example, in terms of the youth in a certain country who wants their country to commit to, for example, let's say the COP26 Health program commitments. So in this case, what I would advise, for example, these youth who are interested together, they get to create together networks, alliances, they get to share the efforts, join the forces together, see what everyone knows about the climate change, see what everyone has in terms of resources, whether human resources, whether financial resources, whether just capacity in terms of competencies, and get to identify together what they can do on the grassroots level. And what I have said before in other panels, that it's very much important to focus on the indirect lobbying. And by indirect lobbying, I mean that we don't just go to the government and tell them, okay, you need to do 1, 2, 3, but we tell the people and we educate them about the rights of healthy environment, the rights in terms of the climate action, so that the people understand what they need to do. And in this case, the people would be I would say, the strongest resource that can be used to enforce governments and enforce decision makers to do things. Even when we speak about health systems, when we speak about any kind of initiatives when it comes to health, it's always people-centered. So once the people are educated enough about the rights to healthy environment, about the right to for their countries to tackle the climate crisis, this would lead us for the people to join forces with these youth, with these alliances, and with these networks in order to provide concrete actions and concrete plans for the governments to do more in terms of the climate crisis. So what I would say in this case, the basic thing, which I also see that it is quite feasible, is the education, whether for the youth and whether for the other sectors, especially the more influencing sectors when it comes to the climate change. So for example, if we're talking about financing, if we're talking about energy, if we're talking about agriculture, these are quite influencing sectors in many different countries. So if we get to educate these sectors, as one of the attendees mentioned already, about the health in all policies approach, about the importance of incorporating climate change and health into these areas, then we'll be able to understand what or how these areas are linking to climate change and health, how we are linking to them, and how we can work together through these more influencing stakeholders in order to influence the decision-making process. So it's just quite simple, the equation. Know your stakeholders who are quite interested, know your stakeholders who are quite influential, join forces with the interested and the influential who are quite interested in your work, and then you will be able to influence the decision-making process at the end. It's quite a long-term thing. It wouldn't happen in one day. It might not happen even in 1 year or in a couple of years, but still advocacy is not just about reaching the idea that, okay, climate change is something that's happening and we need to do something about it. This is a norm that would take us years to reach. However, like just speaking up or just contributing to a decision-making process or contributing to a policy or just influencing something or influencing one person from a decision-making body, this is one level of advocacy, and this is an achievement, even if it's a small achievement, but will lead to further achievements in the future. Thank you.
Thank you, Mohammed. Alison, you wanted to jump in as well.
Yeah, so I mean, obviously, there's the direct approach, trying to get your country to join the direct health initiatives. But there are so many, I think, following what Mohammed said, getting that very strong youth health voice into looking at air pollution, looking at outdoor air pollution, whether it's urban congested areas from transport systems or heavy coal use within that is causing, so looking at the fossil fuel implications, fossil fuel phase out, how that you're transforming your urban environments into clean, healthy environments. There's a real strong position for young medical students coming up, youth voices generally, saying this is about climate, but it's very, very immediately. You're much quicker. Action is going to be clean air is much quicker going to see a direct health implication. Similarly, with food systems, healthy diets, secure diets. How do you get food security and having that health voice in that conversation, and then linking it back to these climate negotiations here. These are direct implications on negotiations here, and they're very immediate outcomes for the populations in those countries. So again, connecting ministries is a really, really important one by getting that youth health voice into those spaces. And I think another element of what's happening here is that a healthier population, one that's got clean air, healthy food, clean water, is a more climate resilient community. If you get a stronger population, they will respond and rebound much quicker, and it will save the country money. There's an economic benefit across it, so link it into the treasuries. So there's many ways in which you can join those dots and show the very immediate benefits of health in taking some of those climate actions, in addition to reinforcing those resilient, low carbon health, health systems themselves.
Thank you. I would like to pass back out to the floor. I saw some more hands there. That's great. Yeah, if you can pass the microphone between yourselves, that's perfect. Thank you.
I don't know that there was someone before. No, okay.
There's a few people. We can carry on, but please introduce yourself.
Thank you very much. First of all, I want to congratulate for the great event and also thank the speakers for the insightful speech that they have performed. I'm Domenico Vito. I'm working on a European project on air quality. I'm also a researcher at the Metabolism of Cities Living Lab at San Diego State University and member of the scientific committee of International One Health Conference that will be held in Catania, Italy, the next September. And actually, I have two questions for the speakers. One is related to the COP26 work program. Actually, I want to ask how the progress of the country that has joined the COP26 health program will be monitored. And the other one is addressed especially to the colleague of the Healthcare Without Harm regarding the connection among the Article 6 and the potential of have resilient structures in healthcare and so on. Thank you very much.
Okay, two very good questions. The first question on how are we keeping track or monitoring the commitments of the countries on the COP26 Health program, would either Dermot or Chris go ahead, please?
Thank you. Yeah, I mentioned data and monitoring as something that's going to be at the heart of Attach, this new alliance that we're inaugurating on the 27th of June. I think we're at the stage at the moment when we are still building up the commitments, the political commitments. So we've gone up to 59 countries. We're hoping other countries will join. Maybe some of your countries haven't joined, you in the room. I think once we've inaugurated the alliance, one of the first conversations will be about the monitoring and how we do that. We've heard about some initiatives like the scorecards that are already there. So there is already monitoring going on, and we need to build on that and improve it. But I think that's number one task. Indeed.
Dermot, you've put your hand up if you'd like to say something.
Just again, to add a little to what Chris has just said, indeed, we will build on monitoring efforts which are already ongoing. At WHO, we have a global survey of country progress on climate change and health, which is usually answered by more than half of our member states. So 100 or more countries already answer that. So as I've said, the initial commitments are designed to be relatively easy to sign up to. So it's asking countries to carry out a vulnerability and adaptation assessment, asking them to develop the health component of a national adaptation plan. And we monitor those, and about half of all countries already have one of those. So over time, we're also looking at getting more countries to do that, but also to improve the quality of those. We now publish quality criteria for those plans. So we're not in the business of trying to beat countries over the head to say exactly what they should do, but we are in the business of continually trying to raise standards of the commitments that the countries have taken. It's the same on the decarbonisation side as well. So initially, we're asking countries to carry out an assessment, and we can see, and we carry out surveys to whether they've carried out such an assessment of their carbon emissions. It's also possible to model to carry out analysis to work out roughly how much emissions come from national health sector across countries. But we are very much in the position of encouraging countries to sign up, to making it easy for them to sign up, and then to support them to take forward action over time, rather than coming in from the start and saying, well, you're not doing enough. This is something that we see as a positive agenda, that we want to be inclusive of countries. But again, as Chris has said, the monitoring is important, and we'll continue to try and get more rigorous methods to continue to raise standards across the sector. Thank you.
Thank you. Can I just ask everyone to put their hands up? I know someone's already got their phone, but can I just see how many got the microphone? Can I just see how many questions we've got? 3. Perfect. Okay, the lady with the microphone, you're ready good to go.
Thank you, and I really appreciate the discussion we have today, which is very insightful, and I appreciate the acknowledgement that finance is key in helping developing countries to fortify their health services, and that there are principles of resilience and equity in this discussion. But I do have one genuine concern with regards to the access to rapid public health responses during a climate crisis. So there might, in the studies, we know that there might be more outbreak of climate-induced and zoonotic diseases during climate change, which require rapid and mass mobilization of healthcare providers and products. So looking at the recent example of combating COVID-19 pandemic, we noticed that there is a serious issue with mobilizing diagnostics, therapeutics, vaccines, medical services, and the likes due to intellectual property restrictions. So how may we address this serious issue which continue to plague our COVID-19 response until today? And this is a topic that is currently still discussed at the WTO. So I would appreciate your thoughts on this. Thank you.
Thank you. I mean, some of that response will go a little bit beyond, the question goes a little bit beyond what we're trying to tackle here. We're not going to solve the world's problems. And I think there are an awful lot of lessons to have been learned, and hopefully during the COVID pandemic, it's really highlighted a lot of those issues so that we are able to tackle them, and we're able to learn from that to be able to have mechanisms and processes in place so that in the future we're able to mobilize a lot faster, and that we can understand where the weak points are that need focus, need investment, and need improvement. If we try to bring that question a little bit back specifically to the climate debate and not a COVID-19 question, which I want to try and bring that focus a little bit back. I don't know if Dermot or Alison or any of you want to sort of comment a little bit in terms of assistance or...
I worked on COVID-19 vaccines,
oh, well, there we
something.
go.
Yeah, I think that's a... I'm glad you raised that point. As you know, James has been saying, there are a lot of lessons. I'm not sure we got it exactly right on the COVID-19 vaccines. It's a very difficult issue, though, because we want to protect investment into new vaccines. So it's not, you know, a straightforward of just opening up IP without the necessary safeguards to not deter new investment in vaccines and work. But I think in this initiative, in ATASH, we are going to be looking at, I know you probably saw one of the working groups will be about supply chains, which I think is relevant to what you're saying, and looking at not only the sort of the carbon neutral element of supply chains, but also their resilience. So I hope it will come up there, and I'm sure it will.
Thank you very much. Has the microphone been passed on? Perfect.
It's here. So first of all, I want to join my colleagues by thanking you for this very interesting side event. I'm Eric Göttinger. I'm a representative of the University Côte d'Azur from Nice in France. I'm the director of an interdisciplinary research federation on marine resources, but I'm also a researcher and team leader at an institute for research on cancer and aging. So a lot of stressors that you mentioned are also inducers or pro-aging factors. Heat or pollutants. So my question is, to what extent is aging a reflection that you include in the health aspect? Because it induces premature aging, and then the aged person are more susceptible to diseases. And then if I may have another very small question that is unrelated to this one, but so there are a lot of actions that I hear that are presented, but data acquisition, data analysis using AI, for example, and data storage, and also for all those actions that are proposed, data monitoring is extremely resource and energy demanding. So what are the actions concerning this aspect? Thank you.
Okay, two very different questions. On the first question, aging, yes, I think from the WHO perspective, we do very much acknowledge that elderly populations are very vulnerable. I can also say this on the side of the work that we do in Europe, particularly when it comes to climate change. We have a big campaign where we look at heat health and the impacts, and the increasing impact that heat is having on populations, but with obviously specifically understanding that we are going to have to target a lot of those actions and a lot of that communication to the vulnerable communities, the largest being the elderly. And this is going to also be not only an increasing issue because of frequency and intensity of heat waves, but also when you factor in the changing demographic, particularly in developing countries. That's just a quick response that I can sort of say on behalf of Europe and a lot of the work that we're doing, but I also will just throw it out to the rest of my colleagues, unless you want to have any observation or anything to say on the aging populations. Dermot?
Well, I see Mohammed had his hand up first, so I'll go after Mohammed. That's okay. I don't know if that's showing on your screen. James.
Mohammed?
Yes, okay, perfect. Thank you so much. So yeah, just in terms of aging as well, as youth and as medical students, and also focusing on this important perspective, just in terms of IFMSA as well, we have our own policy document when it comes to healthy aging, and we're trying to connect it with all the other health issues, including the climate change and health perspective. So it's very much important to include this and to focus even from our side would be our call to action to the decision makers is focusing on, when we speak about climate change, focusing on the life course approach. It's not just about the young people, it's not just about the elderly, it's about everyone, because healthy aging is not just about the older populations, but about aging in a healthy way and avoiding the premature aging, as it was already mentioned by the speaker. So that's the first thing about focusing on the life course approach in general, and also in one of the, I guess it was also a side event on climate change that I attended before, it was very much important to also focus on the inclusion of the older populations when it comes to decision makers, because we can't just talk about the vulnerable groups without the inclusion of the vulnerable groups by bringing their own perspective, by bringing their own ideologies into to the table and identifying what needs to be done from their own perspective as well. So I would say in conclusion, following a life course approach when it comes to focusing on climate change and health, and the inclusion of all populations, including older populations, into the decision-making process, in addition, of course, to the rest of the more vulnerable groups. Thank you.
I can just add a few words, but I think that central point is the one Mohammed has just made about the importance of the life course approach. I think when we talk about climate change and health, a lot of attention is rightly focused on youth and young people, because they will suffer for longer the impacts of climate change, and also partly because of the fantastic, really fantastic advocacy work which we've seen led by youth movements, particularly over the last few years. But it's absolutely true that we are all in this together to some extent. It's just that the impacts are different across different population groups. So as Mohammed has said and as James has said, we completely support that whole of life course approach, and we're just talking about putting into place the right protective measures or the right health promotion measures for different population groups. And just to emphasize that point that James has just made, if you look at an issue like heat stress, if you look at the frequency with which what we currently consider an extreme heat wave to occur, in a couple of decades' time, that will not just be 5% or 10% more frequent, it will be many times more frequent. You multiply that with the urban heat island effect, because more people are living in cities. You multiply that with the number of people who will be in the over 65 age group, which is more vulnerable, and you're up to tens of times more potential impact of climate change on vulnerable population groups. So we absolutely have to take into account that across the life course, but also, I think, as the questioner was alluding to, the positive effects of things like sustainable and healthy diets, making it easy for people to walk and cycle to work, housing which has good insulation, and so on, is all something which also can be particularly beneficial or protective for older age groups. I think I'll just quickly acknowledge the second part of the question on energy demands from data systems. I have to say that isn't something that we at least have thought about up until now from our program, but it is something that needs to be more borne in mind. As we say, we need to do less things on paper and so on. We do more things online, but there are energy demands which go along with that. There are energy demands with storing data, so it is something to be borne in mind. So we'll need to think about that. Thank you.
Thank you, Dermot. Very good questions there. My brain works in a weird way. I realize you asked two questions, but the previous question, there were also two questions, and I realized there was a second question directed to you, Anna, which I forgot about and moved on. And I just suddenly realized, oh yeah, we also had two questions last time. Would you like to jump in on that previous question?
I can try at least. I'm not entirely sure I understood it correctly. You asked about healthcare resilience in connection with the work we do. Well, I mean, I presented mostly the decarbonization initiatives that we have, but we do have a few resilience and adaptation initiatives and projects as well. This is mostly led by our Southeast Asia office, because we do have offices around the world, and there is a lot more interest at the moment and a lot more engagement from our offices in the Global South. And they're the experts on that, so obviously they're leading. But we do also have here in Europe a project on healthcare resilience, which is called Resisto, that we've just started. If you want, you can look that up on our website, where we're trying to help healthcare facilities also to give them a way to assess their own resilience and how adapted they are and what they need to do in order to, for example, respond to the aging population and the higher needs of healthcare that will come across with climate change.
Thanks, Anna. No panel is going to be able to answer every question to full satisfaction. So if you also feel free afterwards to be able to come up and talk to us, and we may be able to also put you in touch with those experts in the different regions also for us at the WHO, and we may be able to answer more questions. I'm a stickler for time. We are going to finish exactly at 1. We're under also strict instructions to do so, but we have one last question. If we could try and make that quick. And
I'll be quick, I promise. So yes, thank you very quickly for the talk. It was really interesting. My name is Eloise Mel, and I'm with the UK Youth Climate Coalition. But I'm also a researcher in climate anxiety. So I was wondering if you could give some more information to who and all of you are doing to tackle the increasing mental health impacts of climate change.
Indeed, mental health impacts. Chris, I know you mentioned mental health in your keynote. Would you like to have a first stab there, or we can pass it to...
Yeah, I mean, it's another good question. For us, we're aware of the mental health impacts, particularly of, I mentioned it in context of these humanitarian crises. And we work on that through our humanitarian department, mostly in FCDO. I have to say, in my department on health, we're not doing, apart from supporting some organizations, we're not doing a huge amount on mental health at the moment. But it's something that we're always open to discuss. And it's coming up the agenda for sure.
Yeah, I think. Okay, can we try and be very quick so that we can close in time? Who put their hand up first? Was it Dermot?
Thanks, and thanks very much for the question. I think I will be quick. I would say that up until 3 years ago, we were doing almost nothing on the connections between mental health and climate change. And since that time, it's the one thing that has been brought up in pretty much every meeting that I've been in since that time. And there's rapidly emerging evidence on this. It's now in the IPCC report. And last week, the week before, we launched WHO's first policy brief on the connections between mental health and climate change, based on a consultation we had with experts from around the world. So I can refer you to that. Unfortunately, I can't share the link at the moment, but I'm sure we can get that to you if you haven't already seen it. But it is absolutely an area we expect to do more on, and we'll be pleased to work with you and others. Thank you.
Thanks, Dermot. Also, to save time, but I can also add a little bit more on some of the work we do in Europe on that issue, but I can talk to you after the event. I think did we have one more intervention from the floor? Liz, did you want to? Yeah. We've got like 3 minutes. Can we just pass the microphone down here, please? Yeah.
Hello. Should I come up front? So I'm Liz, and I work with the WHO with the Geneva team, and I'm here reporting on the ground what we're doing here in the negotiations. And I just wanted to say this, COP26 was a bit of a wake-up call and opportunity to reflect on having a greater impact in the decision-making space. So building on the 30 years of WHO's work in this space and attendance in these meetings, building on the decade of IFMSA and the work of the GCHA, and trying to make a bigger impact in the decision-making space. Here on the ground, we have a strong group, and we're starting to work on some collective action and collaboration. Our group includes GCHA, Healthcare Without Harm, the Lancet Countdown, the Consortium of Universities for Global Health, and we're also working with Youngo Working Group on Health. I don't think I missed anybody there, but there could be more. And we'd like to have more, and that's part of what we're trying to do. In terms of the negotiations, we're starting to follow a range of issues. We've been tracking on mitigation ambition. We've been tracking the global stocktake in several of the roundtables on mitigation and adaptation. We are following the Coronivia program on agriculture and national adaptation, gender, and various other issues. We're not just participating and sitting in the rooms, we're submitting and making statements. You can see some of these on the UNFCCC portal, and we'll continue to have more during the week. And the Secretariat has quite a backlog, so the statements may not be all up there right now, but within a week or two after the event, I'm sure they all will be. If there's anyone interested in what we're doing in that space, I welcome you to come up and speak with me. I'd love to do that, or collaborate with any of our statements. It's a very important area, and we're really trying to build that space.
Great, thank you. As a moderator, we're always terrified that it's going to be a deathly silence in the room. I always rather have a bit of a mad rush to try and squeeze everybody in. Thank you so much for your participation. I'm also very happy to be able to close on time. A big thank you to our speakers, those who have managed to arrive internationally to participate and be here also for the negotiations, but also to Dermot and Mohammed who are online. Thank you so much for joining us. If some of you do feel like you've got a few unanswered questions, but there's someone here in the room who's able to, you think might be able to answer them, please feel free to come up and have a chat with us. At the very least, we may be able to put you in touch with somebody who can answer your question. Thank you. Have a fantastic second week. Have a good afternoon.